Good afternoon, Doctor. We are organizing World Entrepreneurship Summit in Healthcare, the leader who inspire healthcare, and you are the biggest leader.
एक मिनट रुक जाए इसको जरा.
Silent.
टेलीफोन ले जाओ ये.
Entrepreneur, as well as the leader who inspire the healthcare sector. Can you share your success story? How you started?
You know, there is this misnomer success. Success is basically measured in different ways. So it's not important whether you say how you label it, but the point is it's a journey. Life is a journey, and you reach certain milestones in your life. And if you're able to reach it successfully and do what your aims were, then it's success. So in my view, starting from medical school, I found the frustration that there were many patients, many disease forms, like mitral stenosis, like coronary artery disease, like sort of respiratory diseases and all that, where we knew what the patient had, but we could not do any treatment and they would actually pass away in front of our eyes. So that's the most frustrating thing for a doctor, to know what the patient needs but unable to do it. So that's why I decided to go to the US to learn, because I knew that in the US there is treatment for all these diseases was already developing. So that was the purpose of my going to the US, and then hopefully with the aim that I would come back with that knowledge and be able to work it here.
Right, sir.
So then when I went to the US, fortunately I got the opportunity to be trained by Dr. Frank Spencer, who actually is considered even today one of the greatest heart teachers of the world. So having done that and accomplished my full training program, they asked me to join the faculty at New York University, which was also a great thing. So if you say success, the first step success came finishing medical school, second came completing my training in cardiovascular surgery, third came the appointment at New York University on the faculty.
Right.
And then it took me good 11 years from there on to find the way to come back to India, because I always wanted to, because I wanted to bring that whole knowledge, training, research to India. But because there were no institutions that could actually support this kind of thing, we took the long route. We took the long route of building it brick by brick. That's how I built Escorts Heart Institute. And then I moved back. So you would say that is the third stage of success, that what I had thought of, I could accomplish it. Okay. And then in the history of Escorts Heart Institute, we kept building it to a higher and higher level. Till in 2003 I felt that, look, we had reached a stage now where Escorts Heart Institute had served its purpose and we had to go to the next step.
Okay.
And the next step would be institutions like Harvard, Mayo, Cleveland Clinic. Those are the kind of institutions that were missing in this part of the world. Hence the thought came to build Medanta. Okay. Along the way I had enough trouble, in the sense of there was a dispute at Escorts, and I worked at Apollo for 2 years, and while I was completing Medanta, then moved to Medanta. But then you say, okay, the completion of Medanta, the fact that the best of physicians and surgeons joined on the same platform to serve together, all that led to say a successful completion of a mission to say we must bring India to the highest level of healthcare. And I think today, if you look at what we have got and the kind of surgeons and teams that we have and the paramedical that we have, I think that you could recognize that we are standing up to anyone in the world. So that's a nice feeling. Now so you can say it's a success, but what is the next mission? So next mission is twofold. One is to take Medanta to, at least in the northern states, which are underserved. It's like Madhya Pradesh, UP, Bihar, Jharkhand, Northeast, right, Eastern India. is to take this standard to those states. Right? So we already have a project in Indore which is functioning. We have one in Jharkhand which is functioning, but a big one is coming up in Lucknow.
All right.
Okay, for 20 crore people, there is not this level of care available. So why should people have to travel all the way to come here? The expense goes up double. So now what we are doing is, our aim is to provide highest quality of healthcare at people's closer to their homes, right? So that's what's going on right now. That this is what my mission is.
Right.
The other dual mission is public, health and not-for-profit activities. So in the immediate sense, we are launching what we call TB-free Haryana. So this is a mission,
TB-free Haryana.
and along with the government of Haryana, we want to help the government in assisting them to do a like detection of TB is difficult in 50% of the cases because their sputum does not show positive bacilli.
Right.
So that's why with digital X-ray, you can actually diagnose it. So we have made mobile digital X-rays where we will be assisting the government of Haryana or the TB department of Haryana in detecting those cases which are not showing positivity in sputum but can be detected by chest X-ray.
All right.
So we are launching this on the 20th of this month. And the other one is that I do want to make a not-for-profit world-class children's hospital. That is missing in this part of the world, and I think it's time to do it. But I don't want to do it for profit because the parents of children are young,
Right.
and they are starting their life and they are monetarily not as well off. So the children should get the best treatment in spite of the fact that the parents may not be able to afford it. That's the mission. So if I succeed in that, I would have said I have actually succeeded. So that's my answer to success.
Great, sir. Great. Thank you. Sir, you are benchmarking the best practices in cardiac and cardiac thoracic. But how you decided that you are going for this tuberculosis and this TB-free Haryana?
It's not a question of being so different. The point is that you are interfacing with the public.
Right.
And I have now reached a stage where I think that we have achieved whatever to a level where we can now afford to give back to society.
GG.
So now what are the best ways and effective ways of doing it? Now I happen to come across that one of our doctors had actually done a pilot project on detection of TB by X-ray in non-detected cases, and on that pilot, and coincidentally the US aid under the aegis of the US ambassador and then Mr. Amitabh Bachchan and Ratan Tata and myself were invited to a round table.
All right.
And in that, they expressed this desire that why don't we launch a mission TB-free India, which is the mission of USAID. It's known as the Union Against TB and Malaria. So because my doctor had done some work in Haryana already and I knew the background, I offered that why don't we do Haryana, because we are in Haryana.
Why
we
you are
have the
focusing
doctor.
only Haryana? Earlier
No,
were
but you can
also-
only take one bite. You can go other places, but other people will do other states, I'm sure. But I think this model has to be refined.
All right.
There's a huge learning curve here. Once we have the blueprint in a way which can be replicated elsewhere, we'll be very happy to share it. That's what the whole mission is.
Right.
Haryana is controllable by us because we are sitting here, the population is small, the government is very responsive, and the TB officers are very dedicated. So all the ingredients are right. And that's why I think we have a good
Great.
chance of success.
सर ऐसा मानते हैं कि डॉक्टर नरेश त्रेहान सेल्फ स्टार्टर है और डॉक्टर नरेश त्रेहान जो चीज़ करते हैं वो एक बेंचमार्क बन जाती है. हर डॉक्टर अपनी प्रैक्टिस स्टार्ट करना चाहता है. You want to be an entrepreneur. What is your view on this?
देखो ये वर्ड एंटरप्रेन्योर जो है ना, ये मेरे को तो इससे कुछ खतरा भी मत को नफरत सी लगती है. क्या है एंटरप्रेन्योर का मतलब क्या है? अगर जो आपका एंटरप्रेन्योर का मतलब है कि आप एडवेंचरस हो और नई चीज़ें बनाने चाहते हो या कुछ करते हो, वो तो एंटरप्रेन्योरशिप ठीक है, अंडरस्टैंड होती है। पर हिंदुस्तान में एंटरप्रेन्योर तो कहते हैं बिजनेसमैन है जी, बड़ा बहुत बड़ा बिजनेसमैन है।
ठीक है।
सो व्हाट आई एम सेइंग इज कि हेल्थ केयर और मेडिसिन एक इन अ वे धर्म का काम है, क्योंकि यू आर एक्चुअली डीलिंग विद पीपल and in their confidence trying to help them. And many times you enter their body to accomplish like mine, heart surgery हम तो so हमारे लिए सबसे बड़ा जो कमिटमेंट है वो ये है कि पेशेंट को जो दुनिया का बेस्ट आप दे सकते हो वो दो
जी।
ओके। उसके बाद आपको पेशेंट को क्या चाहिए, एक तो आपकी नॉलेज और आपकी स्किल
जी।
दूसरा उसको चाहिए कि आप उसको इज्जत से ट्रीट करें, ठीक है। और तीसरा जब वो घर जा रहा हो तो उसके जेब में कुछ चंद पैसे हों कि वो घर पहुंच सके। ये 3 डिज़ायर होती है हर पेशेंट की। अगर जो आप अपनी सारी लाइफ इस 3 चीज़ों के ऊपर ध्यान दे के हेल्थ केयर करोगे या डॉक्टर बनोगे तो ऑटोमेटिकली आपको आपके पास लोग आएंगे। वही लोग जो सक्सेसफुली आपके यहाँ से जाएंगे वही सैकड़ों लोग लेके आएंगे। आपको किसी से कोई उल्टी सीधी बात करने की, जैसे कमीशन देने की कोई ज़रूरत ही नहीं है
जी।
आपके पेशेंट्स बिकम योर बेस्ट रेफरेंस
जी।
सो मेन चीज़ जो डॉक्टर, मैं ये कहना चाहूँगा डॉक्टर को कि इफ़ यू वांट टू बी सक्सेसफुल एंड सक्सेस इन अ डॉक्टर, जैसे प्राइवेट प्रैक्टिस में हो तो आपको पैसे तो अपने आप ही आ जाएंगे, आपको कभी पीछे भागने की ज़रूरत नहीं है
जी।
सिर्फ आपको अपनी एथिक्स और अपनी स्किल पे ध्यान रखना है। और अगर जो वो आप देने को तैयार हो और अच्छी तरह से इज्जत से देने को तैयार हो पेशेंट को तो कोई कमी नहीं होगी और आपके पास पैसा भी आएगा, इज्जत भी आएगी और फीलिंग ऑफ सक्सेसफुल और सेटिस्फैक्शन भी होगी। जो लोग बहुत जल्दी में आ जाते हैं कि आज ही अमीर होना है कि ये किसी को कमीशन दे दो, किसी पेशेंट का अननेसेसरी प्रोसीजर कर दो, वो क्रिमिनल है
जी।
क्योंकि आपके पास पेशेंट वो धर्म से आया है, वो अपनी पूरी कॉन्फिडेंस से आपके पास आया है, बिल्कुल यू कैन से कि नेकेड है, सब बातें आपको बताएगा अपनी। आप उसको अगर जो बिट्रे करोगे तो इससे बड़ा क्राइम नहीं हो सकता मेरे हिसाब से।
बिल्कुल सही। डॉक्टर साहब, आपके लिए रोल मॉडल कौन है?
मेरा
Who is your role model?
मैं बताता हूँ आपको कि जो मेरा रोल मॉडल है डॉक्टर फ्रैंक स्पेंसर, जिनकी फोटो पीछे लगी हुई है। एक ही फोटो में रखता हूँ अपने दफ्तर में, वो डॉक्टर फ्रैंक स्पेंसर की है।
राइट।
वो ही मेरा एक्चुअली गुरु है।
Why he is your guru?
He is the one who taught me everything I know about my profession. समझे आप? उसने जो वैल्यूज सिखाई हैं, जो स्किल सिखाई हैं, वो मेरे ख्याल कोई बहुत ही कम लोग होंगे जो ऐसा सिखा सकते हैं। तो इसीलिए he is my role model and I try to practice exactly.
Can you share any example or any values given by the guru?
हाँ, तो वो कहते हैं कि एक तो पेशेंट के बारे में ये a patient comes to you unless you treat him like a relative, a brother or a sister, you will never be able to give him your best.
Okay. Right.
So give him your best as if he is your relative. Number 2, on any day, patients and their families will make you feel like God. They will thank you, they'll say you're God to us, they'll do all this. As long as you don't believe it, because if you start believing it, that will be the end of you. Very important. You understand? And the third thing that is also very important to me, what he taught was, if you are not better today than yesterday, then you wasted 24 hours.
Right.
So that means you must learn on every day from your experiences, from the knowledge you can get, from the reading you can do, from your interactions. If you don't learn, if you just sit there that I am the most arrogant person and I am beyond everybody, I know everything, then you will actually go downwards.
ग्रेट डॉक्टर साहब आपको हेल्थ केयर में लोग गॉड मानते हैं, हेल्थ केयर मैनेजमेंट में, एंटरप्रेन्योरशिप में, और ऐसा कहते हैं कि फ्यूचर में हॉस्पिटल आएंगे चले जाएंगे. देयर इज अ स्टडी, only those hospitals will survive having the backup of medical education. Can you focus something that how this medical education will improve the healthcare system or medical management?
See, एक तो if you look at healthcare as an ecosystem, ecosystem which is encompassing so many things. So if you look at it, one is physical, that is you create the infrastructure and you bring the technology.
Right.
The other is the human capital. Right? So in the human capital, you of course need the experts.
Right.
But to support the experts, you need the next layer of expert, third layer of expert, and the future experts.
Right.
So the journey starts for a medical student in his first year of medical school. By the time he finishes medical school, the first day out of medical school, your knowledge is, broad-based knowledge is the maximum.
Right.
Because then you will start focusing on specialty, and then your knowledge in that specialty will keep going up, but the general knowledge will keep shrinking. You get my point? So, you need to have very good grounding in your medical school to be able to be a good doctor or a specialist. Because if you don't have that knowledge, if it's deficient, then your focused knowledge will also always be deficient. And that is where we have a big problem in India. That one, we have shortage of doctors, and then we have shortage of good medical colleges, in the sense that 50% are okay. There are some excellent, but then there are 50% who are actually not anything to be proud of. They are almost fraudulent. So the students coming out of there are also a problem. And then because you get a license for a doctor and you can't be a good doctor, you have a problem. We have a problem. The society has a problem.
Right.
Like Vyapam is a problem.
Yes, definitely.
Vyapam is a huge problem.
Yes, definitely.
Right? So that's why we need to concentrate a lot. And you are right that if we have a hollow education system, if we don't have the peripherals there to train everybody, we cannot be great healthcare providers. That's a correct statement you made.
The staff turnover is very high. Doctors are leaving one hospital, another hospital, management staff, even the CEO and medical superintendent is also leaving very frequently from one hospital to another hospital. Is there is any permanent solution of this problem?
You know, at the higher level, fortunately we haven't seen anybody leave, so which is a good thing. Yeah. But there are dynamics which are around which make it difficult for people to resist the temptation. So the dynamics is there is a shortage of doctors, and everybody went and built a hospital, thinking that you can invest so much money and then make money. Then they have to desperately look for doctors, and then they will poach doctors. So they will offer them more money, a better title, and all this other stuff. So this is a normal game that has become prevalent in our field also. So if you have the right platform with the right ethics and the right environment and the right technology to assist the doctors, they usually will stay stable.
Right.
The problem comes in nursing now.
Right.
That attrition is high because the Saudi Arabians and the Middle Easterns and the so and so and so and so comes and they take away nurses because they pay them 3-4 times. Now it's a problem for us, it's a problem for the patient, it's good for the nurse. So I think what it leads us to is a very urgent need to create immediately very good nursing, medical and paramedical colleges right away.
Alright, great. Another term is this medical tourism. ऐसा कहते हैं कि हम अपने देश के लोगों को इलाज प्रोवाइड करा नहीं पा रहे हैं और बाहर के लोगों को बुला के इलाज दे रहे हैं और उसमें भी हम बहुत सारे हॉस्पिटल्स चीट करते हैं. They are making rates according to the patient. Is this right practice or this where we are going in medical tourism?
See, that is a grey area in our field. to answer the first part of it, that there is no conflict between a patient who comes from outside and our local patients. In a way, maybe it's helpful because it helps the hospitals to cross-subsidize the Indian patient by charging a little extra to the foreign patient. Okay. It also helps the hard currency needs of our country. And then we are importing so much medical equipment, so if we can actually mitigate it a little bit by foreign patients coming, why not? And then it gives India prestige. If people come here, if they get the good treatment, not that they get cheated. If they get cheated, of course, it's a bad thing for our country and we get disrepute. But if we treat them well and they go satisfied at the right price, they are your brand ambassadors. So there is a definite advantage to having medical tourism. On the other hand, when you're saying that they are being actually may not be treated properly or being cheated in some places, that I've heard also. But I think that's terrible because that it becomes the reverse. It ruins the reputation of our country. People don't want to come here anymore. We are not alone. There is a lot of competition around us.
Definitely, sir.
So there are Malaysia, Thailand, every country wants Singapore, every country wants.
Right, doctor.
ठीक है?
Doctor, next 10 year के लिए आपने क्या सोचा? What's your plan? What's your vision for this Medanta?
See, as I said earlier, it's a journey, it's a mission. Now, I felt that we have brought Medanta, which is the highest end, comparable to any of the hospitals in the world. Now, this standard must go to the states. So, since I'm familiar more with the northern states, that's what we want to do right now. So, we have put up a small institute in Indore, where we are offering the highest end of super specialized treatments. We have put one up acquired one in Jharkhand, which is a rundown place, but we are refixing it to bring the standard to Ranchi. Right? We have started construction in Lucknow. We have just got the mandate for Patna, and we have bought Noida. So there will be 5. So I'm completing my state-wise agenda that we bring the highest end of care to different states. So Northeast is left and West Bengal is left, which we will look for. I hesitate a little bit to go below Madhya Pradesh and Maharashtra because the language changes and all that, and the culture changes, and I don't have any experience there. So the need is more. So my mission is to build hospitals where the public desperately needs high-end medical care.
Are you planning any health science university or any medical college of Medanta?
See, I would love to, and if you look at it, we have enough space here. I have 17 acres in the back, I have 10 acres here. The idea was to build a health university, and we will hopefully one day. But the problem is that the laws are a little, I would say, not conducive to the proper creation of a medical school. So they say, you make a trust and then open a medical school. Private, so 2 things are not allowed: private company and teaching in a private hospital. Okay. Now there are 2 problems with it. One, they say, okay, you make that trust and you can charge capitation fee, which I don't particularly want to do. I want to do everything in the daylight, upfront. The fee should be realistic so that you can make it survive. We don't need to make money out of it, but you should make it survive. And so that is one major thing. The other is that if you are saying that you can teach on a poor man but not a rich person, there is a problem. It's against the Constitution of India. The life of a rich man and a poor man is the same. So why are we saying that in a private hospital you can't teach? You make a free hospital where you can put 200-300 people, you can experiment on them. That's not a good thing. That's not a good statement. I did my whole training in New York University, in New York. 90% of my training was on private patients. So I don't understand where this notion came from. I'm sure it's there in the books for a long time, and the current generation of administrators have not really been able to get beyond it. every private hospital should be able to teach the best talent, the best technology,
जी
the best, the maximum pathology is in private hospitals. So why are you depriving our doctors from learning? That's something.
great. Dr. Sab saying that investment in healthcare is growing, but it is still beyond the limit of rural areas. Well, rural population is still not able to afford the healthcare. Any
See, yeah, of course, the cost of creation is too high. And if the cost of creation is too high, somebody has to pay for it if it's in the private domain. So that's why we say that if we align the healthcare delivery system of India, it should include the government, the private sector and the NGO sector and string them in a streamlined way so that they all function with each other. So it is the domain of the government where they have a very active machinery at the village level even to provide primary health care in the government hands. Sanitation, hygiene, government, all this should be government. Up to the secondary healthcare system. So they have the PHC and the CHC and the district hospital. So now you are saying that if that is so, the government can provide that treatment to that level, then tertiary care becomes a very expensive and sort of engagement to create these huge hospitals where you have to pay a lot of money to the doctors and you need technology. Then in that case the government can be a buyer of or private insurance can be the buyer of tertiary care.
Perfect.
And pre-negotiated rates, but you have to pay for that. So if we can get all this worked out, I don't think we need to increase capacity, by the way. Most hospitals have at least 10, 15, some 20, 25% also vacancies. They'll welcome this business at pre-negotiated rates for the economically weaker section. So a lot can be done. But somebody has to sit down and study this properly and string it along.
Great, Dr. Sab. Second last question, Dr. Sab. इतना जो कामयाबी का सफर रहा, इसमें क्या क्या मुश्किलें आई हैं? जहां आपको लगा कि बस अब तो हद हो गई।
ऐसा तो कभी भी नहीं लगा कि हद हो गई।
और क्योंकि
लोगों की बेवकूफियां जरूर सहने को पड़ी बीच में, पर वो ठीक है। पर एक वो कहावत है पुरानी कि एक शेर शायद किसी को बोल रहा है, मेरे को शेर याद नहीं है, पर उसका मीनिंग ये है, और वो एक परिंदे को बोल रहा है कि जो ये तूफान आ रहा है आपके की तरफ, इससे घबरा नहीं, ये तूफान आपको डिस्ट्रॉय करने के लिए नहीं आ रहा, आपको और ऊंचा उड़ाने के लिए आ रहा है। तो इसका मीनिंग तो यही है कि हाउ यू लुक एट द स्टॉर्म।
परिंदे को तालीम नहीं दी जाती ऐसे करके।
ऊपर परिंदा बर्ड ही होता है ना।
आपने नेशनल लेवल पे, इंटरनेशनल लेवल पे काम किया है, आपको क्या डिफरेंस नज़र आता है कि मतलब क्या चीज़ आपको वापस यहाँ खींच के लेके आई हिंदुस्तान में मेरे को काम करना है? क्योंकि डॉक्टर्स जाते हैं, एम्स से भी बहुत सारे डॉक्टर्स MBBS करके बाहर चले जाते हैं। 56% ऑफ द डॉक्टर्स आर लिविंग इन इंडिया परमानेंटली एंड दे नेवर कमिंग बैक।
Not from all over India, but from AIIMS, yes.
Yes. क्या हमें ये चीज़ों को रोकना नहीं चाहिए?
नहीं, बिल्कुल नहीं।
इससे हम अपना टैलेंट को लूज नहीं करते।
अरे हिंदुस्तान में इतना टैलेंट है कि आप सारी दुनिया में भर दे तब भी खत्म नहीं होगा, ये मेरा विश्वास है।
डॉक्टर नरेश त्रिहान की कोई ऐसी इच्छा थी कि वो उनको खींच लाई वापस आ गए, लेकिन हर कोई नरेश त्रिहान नहीं है।
नहीं, देखो मैं बताऊँ आपको, एक तो सबसे बड़ी बात है कि आज एक वर्ल्ड जो है वो एक लार्ज विलेज बन गया है। आपको जहाँ खुशी और जहाँ अपॉर्चुनिटी है वहाँ आप काम करें। हमें इस सिल्क पे कंसंट्रेट करना है कि हम बढ़िया से बढ़िया डॉक्टर रोज बनाए कि जितने मर्जी चले जाएं फिर भी यहाँ काफ़ी हो, क्योंकि टैलेंट की कोई कमी नहीं है हिंदुस्तान में, पॉपुलेशन की कमी नहीं है। इनफैक्ट हमें तो करना चाहिए। मैं तो ये मेरे हिसाब से तो इंडिया शुड बी द ह्यूमन कैपिटल सप्लायर टू द वर्ल्ड ऑफ एवरी वैरायटी, right from the bottom to the top. India should go and conquer the whole world from below up. क्यों आप रोकोगे? 3000 डॉक्टर चला गया साल का, उतना भी नहीं जाता। यहाँ 50,000 डॉक्टर बन रहे हैं, इनकी क्वालिटी इंप्रूव करो ना, उनको क्यों रोक रहे हो?
उनको भी इसलिए जाना पड़ रहा है, जैसे यहाँ MDMS में इतना हाई पेशेंट्स है, एडमिशंस नहीं है, सीट्स नहीं है।
नहीं देखो, आप जो ऑल इंडिया इंस्टीट्यूट वाले तो फ्रंट लाइन पर बंदे हैं, ये नहीं कि हमें यहाँ वो पोस्ट ग्रेजुएट नहीं मिलता इसलिए हम गए थे, वो गए थे बिकॉज दे वांट टू परस्यू द हाईएस्ट लेवल एंड दैट इज गुड फॉर इंडिया। अब मैं वापस आ गया, कई लोग नहीं आते पर वो विजिट करने आते हैं, अपनी फैमिलीज को पैसे भेजते हैं। $70 बिलियन कहाँ से आता है हिंदुस्तान को? अगर जो $70 बिलियन बंद हो जाए तो हमारी बहुत बुरी पतली हालत हो जाए। तो हमारी तो ये इन्वेस्टमेंट है ओवरसीज। हाँ, आप अट्रैक्ट करें तो जरूर आएंगे लोग, मैं तो रोज लाता हूँ वापस।
Great, you're doing wonderful job, Doctor. Last question: any advice to the healthcare entrepreneur, the doctors who want to start their own hospitals?
You see, basically, you must understand that it is a process, and in the natural scheme of things, it comes. It's a good idea. But the moment you say कि मैं एक business की नज़र से एक hospital चलाना चाहता हूँ या अपना nursing home, तो business उसमें hazards बहुत ज़्यादा है। क्योंकि अगर जो आप, जैसे आप हिंदुस्तान की एवोल्यूशन देखोगे हेल्थ के, पहले सिंगल डॉक्टर होता था, वो अपना सारा दिन स्टेथोस्कोप लगा के दफ्तर में 100-200 पेशेंट देखता था। फिर उसकी वाइफ बननी शुरू हो गई डॉक्टर, तो ये 2 हो गया। अब 2 एक छोटी जगह पे हैं, तो उन्होंने कहा जी चलो अब थोड़ा, पहले 2 दफ्तर हैं तो इसके 2-4 कमरे भी खोल लो, क्योंकि लोगों को जरूरत होती थी। तो वो स्मॉल नर्सिंग होम बन गया, फिर उससे बड़ी और, तो उससे बड़ा और। सो ये एंटरप्रेन्योरियल स्पिरिट तो है ही हिंदुस्तानी में, उससे बड़ा नर्सिंग होम बन गया। फिर उसकी बच्चे डॉक्टर बन गए, उनकी शादियां हो गई, तो कोई गायनेकोलॉजिस्ट है, तो कोई नेफ्रोलॉजिस्ट है, तो वो फैमिली एंटरप्राइज में ही वो 50-60-100 बेड का हॉस्पिटल बन गया जी। अब उनको, और अगर जो टैलेंटेड हैं और ठीक तरीके से कर रहे हैं तो वो सक्सेसफुल भी होंगे, क्योंकि उसमें क्या है कि एक तो वो सर्विस कर रहे हैं, ठीक क्वालिटी दे रहे हैं, कॉस्टिंग थोड़ी रीजनेबल है, उनके ओवरहेड्स नहीं है, क्योंकि वो एडमिनिस्ट्रेटर भी है, चेयरमैन भी है, डायरेक्टर भी है, कैशियर भी है, सब कुछ है वो डॉक्टर, समझे। उसको अगर जो अपनी फी मिल रही है 3-4 लाख और कुछ हॉस्पिटल से इनकम आ रही, तो वो बड़ा सिग्निफिकेंट मॉडल बन जाता है उनके लिए, इनकम मॉडल। जो लोग अपनी रीच से बाहर जाते हैं कि जी मैं एक बना लेता हूँ 100-200 बेड का हॉस्पिटल, पर मेरे पास वो है नहीं और मुझे एक पूरी एडमिनिस्ट्रेशन हायर करनी पड़ेगी, मुझे सारे हाउस कीपिंग ये वो सब हायर करने पड़ेंगे, उसके अंदर चैलेंज हो जाता है कि अगर जो आपकी ऑक्यूपेंसी ठीक नहीं है या केस मिक्स ठीक नहीं है, तो अब आप प्रॉब्लम में आ गए, लोन ले लिया। अब सबसे बड़ी बात ये, जो मैं आया था हिंदुस्तान तो मुझे IDBI ने अपॉइंट किया एक बार कमेटी में कि यहाँ पे हमारे तो 94% लोन्स पे ही नहीं कर रहा कोई डॉक्टर। तो मैंने जो सोचा कि इन्होंने क्या किया कि डॉक्टर को 80-90% लोन दे रहे हैं, मेरे को बेचारा कहाँ से निभाएगा। नेवर गिव मोर देन 50% लोन टू हेल्थ केयर फैसिलिटी, तब तो वो कर लेगा, पर अगर उसके ऊपर डेट बर्डन इतना डाल दोगे तो वो नहीं कर सकेगा।
जी जी।
तो इसीलिए ये चीज़ों को ध्यान में रखते हुए जब आप एंटरप्रेन्योरियल स्पिरिट को अनलीश करते हैं अपनी, इतना सोच लें कि सिर्फ आपके टैलेंट पे ही जरूरी नहीं कि सक्सेस होगी, यू नीड द होल इकोसिस्टम शुड बी देयर टू गिव यू दैट सक्सेस।
ग्रेट सर, थैंक यू सर, थैंक यू वेरी मच, रियली प्राउड ऑफ यू,
ऑल द बेस्ट,
थैंक यू।
I'm privileged today to be able to congratulate the awardees who have achieved so much in the field of healthcare, that today they stand tall at the top of their fields and deserve this coveted award. So my heartiest congratulations and great success for the future.
Thank you. Thank you so much.